Deni Avdija of the Washington Wizards went down tonight with a very gruesome looking right leg injury, and this one was very worrisome after it happened because as soon as it happened, he was obviously in noticeable pain and he would require the assistance of a wheelchair to get off of the court. Now, on the actual play that Avdija was injured on, we saw that he received a pass underneath the basket and he would jump to go up for the shot. But unfortunately, as he was coming down from the shot, he landed a little bit awkwardly with that right foot getting twisted underneath his body. As that foot seemed to get twisted underneath his body, we saw that his entire body weight would actually go onto that right foot in that position. And right after he came out of that position, he was really grabbing onto that right ankle area. Now, from the get-go, this injury did look very serious because Avdija was obviously in a lot of pain and once again had to leave the floor on a wheelchair. Unfortunately, tonight, sources have revealed that Avdija is in fact dealing with a hairline fracture in that ankle, and as of right now, he's expected to miss the remainder of the season. And one other piece of news, as of right now, it's not expected that he will require surgery, but he's going to be having an MRI tomorrow to also rule out some other serious conditions. Now, because some people may not be too familiar with what exactly is going on when somebody has something known as an ankle fracture and what a person can also suffer when they land in this sort of awkward twisted position, I'm going to go ahead and focus on that in today's video. Welcome, basketball fans. For those of you that aren't familiar with me, my name is Nick Gallo and I'm a doctor of physical therapy. And with this video, we're going to take a very close look at Deni Avdija's most recent right hairline fracture to his ankle against the Golden State Warriors. First, I'm going to start by showing the play that Avdija was injured on so that we get a good visualization for his mechanism of injury. Then I'll go over the anatomy associated with a hairline ankle fracture. And finally, I'll go over why the position he landed in is so compromising for the ankle and what to expect moving forward. If you like today's video and you find it informative, please hit that thumbs up and subscribe to the channel because I will be making more videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you have any comments or questions, please leave those in the comment section below. Now to begin, let's take a look at the play that Avdija was injured on.
Here we see Avdija receives the pass, goes up for the shot, and comes down awkwardly onto that right foot and grabs at that right ankle area in noticeable pain. The pain is so great, he would actually require the assistance of the wheelchair to leave the floor. We see here in slow motion replay that he's going to go up to the shot here. His right foot will make contact normally there, but as he stumbles, it becomes twisted under the full weight of his body right here.
So here I have a model of the foot and ankle, and so the two long bones in the lower leg, the tibia and the fibula, are going to come down and make either side of what we know as the ankle joint. Now, medially, or on the inside of the ankle, this is where the tibia is going to form a section of bone known as the medial malleolus. And on the outside or lateral portion, this is where the fibula is going to form a section of the bone known as the lateral malleolus. Now, right below these two bones, there is another bone known as the talus, and you can see that bone right in through here. Now, these three bones, the tibia, the fibula, and the talus, they're going to make up the joint that we know as the ankle joint. And typically at the ankle joint, this is involved in a lot of different motions that are very applicable for sports. They are dorsiflexion, where the foot is going to be bending upwards like this. Another one is plantar flexion, where the foot is going to be pointed down this way. Then, of course, we see inversion, where the foot is going in like so. And finally, eversion, where the foot is going to be pointed outward like that. Now, on the play that Avdija is injured on, we see that as he comes down, the foot is sort of twisted like this. And as he's landing on, he's going into an excessive amount of dorsiflexion. Then we see that as he rolls back, his foot sort of externally rotates like this and goes back into a normal position. And this is a very compromising position because, of course, we do have a norm value for dorsiflexion, and typically that is 20 degrees. Now, when a person goes beyond the normal amount of dorsiflexion, this is when we're going to potentially get some contact between the bones that are located in the ankle joint. Also, if a person happens to land in either inversion or eversion, this can also lead to some other fractures of either the lateral or the medial malleolus. Now, all of these positions are compromising for the bones. Another one that can also be involved with this is, of course, the talus. Now, as of right now, they haven't released specifically what ankle fracture he is dealing with, but Typically, when they will say a hairline fracture or a fracture to the ankle, it is most likely to one of these malleoli right here, or to the talus, or it could be multiple of them. Based on the video, as soon as he gets out of that compromising position, we see that he obviously is grabbing to his leg and he starts to grab to the lateral portion here. So based on that, it looks like he was having a lot of pain in that lateral malleolus area, but once again, we don't know specifically where the fracture is. Now, as a person goes into a rotational force, which we saw with Avdija with this injury as well, this is going to put them at risk for damage to a few other structures, and they are known as the high ankle ligaments because they are actually located directly above the ankle. There are actually two of these high ankle ligaments, and they are actually known as the anterior inferior tibiofibular ligament, and that is located right in through here. And then also there is one located on the back, and this is known as the posterior inferior tibiofibular ligament, located right in through here. And basically these two ligaments, what they're going to predominantly do is prevent separation of the tibia and the fibula. We also have a big interosseous membrane which runs from the bottom to the top of the tibia and fibula bones to also prevent this separation, but predominantly here in the high ankle area, they're going to prevent that separation, which as a person gets some rotation, as you can see right in through here, whether the foot is planted on the floor or the turf or something like that, and you put a rotational force through here, you can see as those two bones begin to separate. So when a person goes into a rotational force like that, this also puts these two ligaments at risk. As of right now, we don't know specifically whether or not he's also dealing with a high ankle sprain or high ankle injury, but given the fact that he is having an MRI tomorrow, this is most likely going to tell us whether or not this soft tissue or any other soft tissue is damaged. Now, these high ankle sprains differ from what we know as a typical ankle sprain or a low ankle sprain solely based on location. For example, if you've seen any of my other videos, you'll know that as a person is going into that inversion ankle sprain position, most likely and most commonly the ligament that is affected here is that anterior talofibular ligament, or the ATFL for short. You can see here that that is located sort of below that ankle joint position. In the high ankle sprain, because they are located a little bit above the ankle joint, this is why they're referred to as a high ankle sprain. Now, going back to what we absolutely know, we know that he is in fact dealing with a hairline fracture of the ankle. So as of right now, it seems like he only has one fracture, but once again, it's very possible that sometimes a person can have multiple of these fractures. So we're going to have to wait and see what exactly the MRI is going to reveal tomorrow, whether or not there is any other soft tissue damage or there's any other type of fractures that are located within the ankle joint. The one piece of good news for Avdija is the fact that as of right now, they are saying it's not expected that he's going to require surgery. Most likely, when a person does not require surgery, this means that the fracture is not significant enough to cause displacement. The fact that it is a hairline fracture means that it's most likely not displaced, and it is more of a fine, small looking fracture on the x-ray, but it's going to be really important that we also get that result from the MRI as well. Now, unfortunately, they have revealed that Avdija is expected to miss the remainder of the season due to this hairline fracture. This is most likely because when a person does have this hairline fracture or fracture to the ankle, they're expected to be out anywhere between 4 to 6 weeks to allow the bone to have adequate healing time. Then, once a person is going to be out of that immobilization, they're going to be in therapy to help and try and restore the normal range of motion of the ankle. Then, as they start to progress through therapy, they're going to start to add in more strength training. Then we'll start to see a lot more weight-bearing exercise, and finally, sport-specific exercise. As of right now, it looks like the NBA season is tentatively scheduled to end their regular season on May 16th, which would put us less than 2 months away from the end of the regular season. So it looks like the prediction for him to be out the remainder of the season is very consistent with the remaining time. So as of right now, it looks like he will in fact be out for the remainder of the season, but I'll also be sure to monitor his case and update everybody because sometimes these things can change. Also, if I hear any updates regarding his case, I'll be sure to update people in the comment section. And of course, if you happen to hear an update and you want to update people, please feel free to do that as well. And that's it as of right now regarding Deni Avdija's most recent right ankle injury against the Golden State Warriors. Once again, thank you very much for watching. I really appreciate it. If you like today's content and you want to see more, please subscribe to the channel because I will be making more videos in the future. Thanks for tuning in, and I'll see you next time.